Hi, I'm Dr. Jeffrey Antimarino from 𝗛𝗲𝗧 𝗧𝗔𝗞𝗘𝗦 spa. Welcome to our new topic. It's called Hot Topics, actually. So it's a new program we put together. This is where patients can write in about things they're seeing on social media. And they're asking us how much of it is real, how much of it is not. So I'm looking forward to this because there's a lot of craziness out there. And I have to just kind of start this whole thing by saying, if something sounds too good to be true, it probably is. And some of the stuff that you are all looking at on social media, remember, a lot of it is just not real. So start with being skeptic about what you're seeing. And there's just stuff out there that's just crazy. And we used to talk about, oh, we all had to fight Dr. Google. And then it was what I always called the housewives of Facebook. And now it's TikTok. And I have patients that are saying, well, you know, they're coming in for this or that, but they looked on TikTok and now they want to talk about it again. Remember, people that are on TikTok and social media, the vast majority are not physicians or surgeons. They are people giving you their opinion, or they are people now trying to be influencers and make money that way. I've watched these videos. There's a lot of craziness. So let's get started. And the first one is about vitamin infusions. So I have never been, again, personally, I've never been a big fan of vitamins. I don't think the average person needs a lot of vitamins. We're supposed to take in our nourishment through our diet and with exercise and our meals. So that's the way we were designed. That's the way it should be. Now, if you are deficient in magnesium, calcium, especially women as they get older, zinc, things like that, absolutely. Vitamins are good for you because you're replenishing something that you are lacking or you're not absorbing well. There's a lot of patients that have had gastric bypasses, so they have problems in reabsorbing protein, certain vitamins, and so you have to be cognizant of that. But for the average person who's living a healthy life, and especially younger people, infusions of vitamins is just a way that some clinic or spa or something is making money on you. Most of it is just urinated away. It looks, you know, bright yellow urine makes you feel better, fine, but you're wasting your money. So I would tell you, check with your doctor, your primary care, your gynecologist, whoever is following you. And if there are issues with your lab data, your electrolytes, things like that, figure out a way with them what you need to have replaced. But just to go into a spa and get vitamin C and vitamin B12 injections, I'm going to tell you, you're wasting your money because you just don't need it. So that's number one. Number two, this one always cracks me up, face yoga. People have been talking about this since I just started in practice, and I've been out in practice about 24 years now. These contraptions that people used to buy to work out the muscles in their face, as we age, the muscles in our face don't change a whole lot. The reason we age has nothing to do with muscles. So doing all the face yoga in the world is not going to keep you from aging. It's not going to keep your face up where it needs to be. Genetics and lifestyle play a big role in that. So eat healthy, exercise, but that's just the way it's going to be. So face yoga, I watched some of the videos, it's absolutely crazy. So don't buy these instruments you put in your mouth and do different motions with your lips or bite down and try to build up your masseter muscle. It's not worth it. It's not going to help you. So move on from there. The new one, salmon semen injections. So they're either injecting it or they're spreading it on the face and using microneedling to push it through the skin. You know, it's because of the proteins that are in the salmon semen. There's really no data that supports that. I just think that it can cause an inflammatory reaction. You might get a little bit of swelling. But I would tell you for now, I just think that it's, again, something, it was sort of like what the Kardashians were talking about with the vampire facelifts and PRP and things like that. Yes, it can cause a little bit of inflammation. We use PRP for a lot of things. It's very useful. But vampire facelifts, semen injected in the face, it's not going to give you the collagen that you want. It's not going to stimulate your collagen. It's not going to make you look younger. So again, you're going to be spending money on something that just doesn't work. So I would tell you, even though there's people studying it, I would be very surprised that if this catches on to where it's real, there's absolute science backing that this is going to be helpful, I would tell you just stay away from it, save your money. Selfie dysmorphia. We're living in a time where it's hard to believe anything you hear on the news, on the radio, what we see in print, what we see in, is coming through social media. People don't look like that. And so with these filters, what the problem is people are looking at these filters and saying, that's the way I want to look. There can be some changes that plastic surgeons can do to help tighten, move things, reshape things, but to sort of look almost like what you're going to see in a filter is just, I think there's other issues that person has. It's a red flag to any type of plastic surgeon, dermatologist, cosmetic surgeon, that this patient, if they bring in the selfie and say, I want to look like this. We had that years ago when patients wanted to look like certain movie stars and TV stars. You just sort of have to move away. A lot of times this body dysmorphia actually is getting worse because of the filters on social media. So you want to play around with them and have fun and send them to your friends, that's fine. But it's going to be very difficult to make you look like that in most cases. We're able to do certain things to enhance or to remove, but realistically, the selfie dysmorphia, try to stay away from. The last one here is mouth tape. We kind of talked on this a couple of months ago, I think, on our other topics, and it's a little crazy. I saw some of the videos that were out on social media, and again, one of them is a guy laying in bed, his dog's walking in the background, and he's trying to tell you which ones to buy and what the myths are about it. I don't even know who this guy is. I'm sure he's not a physician of any type telling you what the benefits are. The only thing that mouth taping can do is force you to breathe through your nose. And so that might be a benefit to some people to help them stop snoring or anything, dry mouth, other issues. But again, if you're having problems sleeping, you need to have to be worked up, do a sleep study, find out what the issues are. But mouth taping is not going to change your lower jawline. I saw one lady said she used it for 60 days. She showed a picture of herself 60 days prior and what she is today. It looks exactly the same. She's trying to get the audience to believe that somehow, she's more sculpted. It just doesn't work. It's not going to change anything. Somebody else said it's going to build up the jaw muscle here. It was just the masseter muscle. You want to do that? Chew gum. But I don't think mouth taping is going to change your profile at all. So again, stay away from that. Part of that video that somebody sent in was, extreme nighttime things that people do to help, stay younger. And it's a lot of it's overkill. The biggest thing is good skin care, hydrating your skin. Retin-A is good, getting your sleep, getting hydrated water, some type of, electrolyte water a little bit, but realistically, drink plenty of water, get sleep, eat a good diet, and then, if you're having issues with sleeping, again, as I said, get somebody to study you. But to do all this taping at night and all these different goops and creams and stuff, it's really not going to change anything. You're spending a lot of money that you don't need to spend, and, see your dermatologist, see a plastic surgeon. Let them analyze your skin. We have a device that helps analyze skin. We have different lasers that help resurface skin to stimulate some collagen growth, to take off the sun damage, to resurface the outer part of the skin, giving that skin that shine again. But we always talk about sleep, hydration, and a good diet as well. It's all part of it. So these trends were great. I love this new segment we're doing. So if you see anything crazy on social media, please send it to me, because I love to see the videos. It's a good laugh. That's what I use social media for anyway. It's for entertainment, and that's what this is. But again, remember, people on there are trying to get your money, trying to get you to follow them so that they have more advertisement. Most of them are just like everybody else. We don't know what we're talking about. You probably already know more about the subject they're talking about than they do. Don't give them your money.